Since the pandemic began, nearly 30 million Americans have been diagnosed with COVID-19, and more than 500,000 have now died in the last year.
But what many people have not talked about are the staggering medical bills run up by those who had the virus.
Well, tonight, WATE 6 on your side consumer reporter Don Dare talks with a COVID-19 survivor who has accumulated, listen to this, more than $500,000 in medical charges.
That's exactly right, Lori. The bill is staggering. Kenitha Tadlock had health insurance, but not enough to cover all of her expenses. She applied for workers' compensation, claiming she was exposed to the virus at work. But the Tennessee Workers' Comp Bureau denied her claim, saying there is no evidence she was exposed at work. Kenitha Tadlock isn't sure whether or not she'll ever regain good health again after contracting COVID-19. The 45-year-old grandmother depends on oxygen to breathe and a dozen prescription pills daily to function. On September 22nd of last year, Kenitha's husband rushed her to the emergency room at Jefferson Memorial Hospital.
I almost died.
And for more than 3 weeks, she struggled for her life.
I'm very lucky to be here.
You're lucky to be alive.
Yeah, my organs started shutting down. I went sepsis in the hospital, and that caused the organs to start shutting down.
She reads from the hospital's diagnosis document.
It says COVID, acute respiratory failure, sepsis, and organ failure. I was dying. They didn't expect me to live. They said that they didn't give me 48 hours and I was going to expire.
Little did I know that 28 days later, would be how long it took for her to come back home.
Married 2 months before contracting the virus last year, Kenitha says she was rarely ill.
Before COVID, I was good. I was up and running. I was like a normal 44-year-old woman.
And now?
I can't even play with my grandkids. I mean, I've got 3 beautiful grandkids. I can't do that.
Acting as a caregiver, Steve makes sure his wife's oxygen machine functions properly.
This is my oxygen, and it's got 50 foot of line on it. And this is my cannula. This is what goes into my nose. Like that.
There's no guarantee that she'll ever be able to work again, from what the doctor's saying.
Ms. Tadlock worked at a regional propane gas supply company for 2 years and believed she had adequate health insurance. She said her company-based insurance covered initial medical expenses, but then maxed out. However, her expenses continued to accumulate.
I have thousands upon thousands of dollars worth of medical bills.
How much?
A grand total of $400,000.
With a $400,000 medical bill, how much is your insurance covering?
That is after the insurance. It started over $600,000.
This is all the workman's compensation.
Hoping for financial protection, Steve sent paperwork to the state's Workers' Compensation Bureau. Kenitha claims she was exposed to the virus at work after she said a fellow employee tested positive. The response from the state was not what they expected.
No evidence the injured worker was exposed to COVID-19 at work. The burden of proof is on her to prove that she got COVID at work before they do anything.
Protected under the government's Family and Medical Leave Act, Kenitha's disability income expires March 24th. After that, there is no income.
Because I'm not going to have any money after the 24th. I can't afford it now. They only give me $349 a week. Is what short-term disability is.
Steve's had to dip into his savings to chip away at their ever-growing medical expenses. Already, debt collectors have been calling, demanding the couple pay their bills.
There's nothing in line for people like me to pay that bill for me.
Kenitha has appealed the workers' compensation denial of her claim. Now she waits for a hearing that is set for May the 4th. 6 on your side contacted Ms. Tadlock's employer. Bossman Gas of Mississippi says it cannot comment on personnel matters. We'll follow her story as she appeals her case before the Compensation Bureau. Now, insurance experts say with COVID-19, you need to understand the ins and outs of your health care coverage. You will want to know things like, what does your insurance cover? Another question, does your coverage pay for state-of-the-art medications? If you go on a ventilator, what will it cover and for how long? And does your plan treat COVID-19 hospitalization different than other hospitalizations? These are questions that are being asked across the country. Bo?
All right, Don, thank you. And of course, we're going to continue to follow her story for you. She appeals her case with the state. All right, if you have a question for Don, a consumer question that you'd like to ask, send him an email at ddare@wate.com. You can also call a 6 on Your Side hotline number, 865-633-5974.